Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. So I hope everyone had a good October and a good Halloween as we head into November. I cannot wait for Thanksgiving and the holidays and everything that goes with that. Now, I'm recording this prior to November 1st, so I'm going to make an assumption that we are still shut down from the government. So we'll find out. You'll find out next week, but right now, as I am actually recording on Halloween, for the Terry Tuesday segment, it'll be interesting to see what actually comes out of it. As you know, a lot of benefits end on November 1st, and so we'll see what happens. I'm surprised that nobody's actually called chicken yet because it's just crazy. As you know, telehealth is still down, and there's benefits, SNAP benefits, WIC benefits. People aren't getting paid. You wouldn't catch me riding an airplane right now just because I just can't believe that we're here. So hopefully things will change by the time you hear me again the following week. But for today, I wanted to just shift gears a little bit to a topic I actually love talking about. And that's when somebody asks me a question and says, who's responsible for claim denials? Is it the biller or is it the coder? Well, let's talk about this from just not from a workflow perspective, but also a revenue cycle management perspective. Medical claim denials are a shared responsibility. Now, the biller is primarily responsible for managing and resolving them, but the coder is responsible for the accuracy of the codes, the initial codes that lead to claims. The coder's role is to translate clinical documentation into correct codes. We know what our jobs are. But if those codes are wrong, or if the claim denial is due to other factors, then it gets to be the biller's job to handle the denial, resubmit the claim, and appeal if necessary. And that's where it gets pretty dicey because you need to know who your coders are. So let's talk about the split in responsibility. And it's interesting, when I used to do quite a few live seminars, and now I speak at conferences, but mostly everything's virtual. I used to get people saying, billers knew who the coders were, but the coders said that they didn't have any responsibility on the back end. And, I've been a certified coder since 1991, and it's crazy to me to think that that was somebody's position. And so that's kind of interesting to me just to hear that kind of phrase. A medical coder's responsibility first is code accuracy. The coder's main job is to assign the correct medical codes, CPT, ICD-10, and HCPCS, based on the medical record. So you're extrapolating codes based on what the documentation says. You're basically translating that patient's clinical record. And then claim foundation. Accurate coding is essential for the claims process to even begin correctly. If the documentation is incomplete, this can lead to a denial, which can be a consequence of the coder's initial input that then we got to go back to the provider. Now, the medical biller's responsibility, and I am trying to, delineate between the two, submission and follow-up. So the biller takes the coded claims and submits it to the insurance company. Denial management. So when the claim is denied, the biller investigates the reason for the denial, which can be due to the initial coding or other factors such as payer policy changes, eligibility issues, administrative errors, frequency guidelines, whatever. And then there's an appeals and resubmission process if it's warranted. The biller works to correct those issues, so you need to know, the names of your coders and hopefully have a good relationship, and then resubmit the claim or file an appeal if the denial is incorrect. Now, is there a shared responsibility? I believe there is. Denial analysis is one. It's crucial for both the coder and the biller to work together to analyze why claims are being denied. I know in some practices in the revenue cycle management department, you maybe not have a workflow that works that way, but think about it. The coder can help fix coding issues for future claims, and the biller can address non-coding related problems, so payer policies, denial codes, etc. But from a compliance perspective, everyone involved in the claims process shares responsibility for ensuring that it's compliant. And you have to have good medical coders, good billers, And the responsibility of those denials is really a shared responsibility. So when you look at some of these things, it's interesting because I always see somebody trying to put blame on somebody, and that's not really what you need to be thinking of. First, you need to think what went wrong. Okay, so if you get a denial, what went wrong? And did the clinical documentation support what the coder submitted to have the biller then submit to the insurance company? And then was that appropriate? Making sure that those claims were accurate, and then looking at the other factors possibly, maybe incomplete documentation, again, payer policy changes, or, what errors were there for the revenue cycle, because maybe it was place of service was wrong. That's not a coder situation. I mean, unless the coder is responsible for all of that and maybe entered, it was done in the office when it was actually done outpatient. That would be a different, it would be 22 instead of 11 as far as the place of service. Or maybe it was an ICD-10 CM code, so it was a diagnosis code that was linked when it was entered to the CPT line item, and it's not an appropriate code that wouldn't support that code. They call those minor errors, a mismatched code or incomplete documentation. Those are, big denials. But medical coders, they rely heavily on the clinical documentation provided by providers. So if the documentation is unclear or incomplete, and you're a coder that's now using incorrect or unspecified codes just to get the claim through, your likelihood of denials absolutely increases. Now, as far as, billers need to also look at this and make sure that, and this is what I recommend to all revenue cycle companies and revenue cycle departments, is you need to have experts in certain payers. So you should have Blue Cross Blue Shield experts. You should have Medicare, Medicaid experts. You should have the, different commercial plans that you have a high volume expert. And then you have somebody that should just focus on patient statements. That's the best way to really look at, positive and successful workflows. It reduces a lot of the ambiguity, so somebody isn't trying to find, how can I figure out this denial, or how can I figure this out? If you are, really good at knowing your policies, knowing what is going on with that payer, and really trying to avoid those denials on the front end. And sometimes I know that's tough, but you really have to take your job, whether it be a coder or a biller, seriously, and make sure that you've got not just the correct codes, whether it be procedure or service codes, the right modifiers, the right place of service, the right provider information, patient demographics, the current insurance information. And then the billers, it's really important that you are checking within the system to make sure that the criteria for payment is there. The patient signed an ABN if that's necessary, or the frequency guidelines were met. There's things that you need to know also to make sure that you can avoid some common denial and rejections that come into medical claims that doesn't necessarily lie just with the denials of coding. And, we know that there could be coding errors. We know that there could be mismatched procedure ICD-10 codes. And we know that there can be some policy issues, but there's also other things that billers should look at as well for claim rejections and denials. So what about credentialing issues for the provider? What about if it was a non-covered service and nobody checked? What about that medically unnecessary service? I'm seeing that a lot. What about a missing referral from a primary care physician to a specialist? If you're a podiatrist, what about the referral for diabetic shoes from the primary care provider? Incorrect patient information. So those kinds of things are so important that you have clean claims. It's not just the coding, it's not just the insurance, it's a lot of information that goes into the success of having this done, and it is a shared responsibility between the coder, the biller, the clinician, the compliance department, you name it, the credentialing department, all of it. Everyone has to take a responsibility in making sure that coding errors and billing errors and just denials themselves are not just blamed on one person or one type of professional within your revenue cycle management staff. So let's try not to do that. Okay, well, where I am recording right now, I hear screaming kids outside, so I'm going to call it a day. But I hope, again, everyone is looking forward to fall, getting those, hazelnut lattes on, anything pumpkin spice, even though I'm kind of over it already, and that you're looking forward to Thanksgiving. Make it a great week, everyone. Make it a great day, and thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.